Okay, great. Well, thank you all for joining. Good morning. My name is Amir Sadeghi. I'm a policy strategist at the Center for HIV Law and Policy. And this is an urgent press conference to stress the need for sexual health literacy for our healthcare workers. We're joined by Assemblymember Linda Rosenthal, Chair of the Committee on Social Services. We're also joined by public health experts, HIV clinicians, activists, health equity advocates, and LGBTQ leaders who are here to talk about the urgent need to fill an education gap that creates barriers between the patients we most need to reach and the care they are seeking. A bill has been introduced in the legislature by Assemblymember Rosenthal that would do just that. This is critical from both a public health perspective and a health equity perspective. A key pillar of the plan to end the HIV epidemic is increasing HIV testing. We hopefully have learned powerful lessons from the COVID-19 pandemic that we must work to fight legacies of medical mistrust by building a patient-centered, affirming, culturally competent health system. By building a system that takes legacies of medical mistrust seriously, by encouraging respect and dignity in care for all patients. However, we cannot expect people at risk for HIV or STIs to present for care or stay in care if there is still a high risk of humiliation, misgendering, dead naming, trauma, and discrimination due to provider discomfort and inexperience. Patients rely on guidance from their healthcare providers to make healthy decisions for their well-being, receive treatment and prognostic care. However, providers can exhibit overwhelming discomfort or altogether avoid conversations with their patients about sexual health and STIs, especially with patients that come from anywhere outside of the heteronormative. Public health experts are already raising the alarm on how syphilis diagnoses are rising and showing a dangerous trend. They're raising the alarm by urging that as we make progress combating COVID-19, and we make life-saving vaccinations accessible to all adults, the risk for a boom in STIs remains high. Many physicians may have been trained at a time when syphilis was almost eradicated and who are thus not familiar with identifying it and are not counseling their patients about it. We have seen troubling proposals nationwide that would seek to criminalize people affected by HIV and STIs. HIV is already criminalized in a majority of US states, and lawmakers are advancing bills to increase criminal penalties for people affected by STIs in Pennsylvania, Texas, and Louisiana. We know that carceral responses to public health problems are not only remarkably inadequate, unjust, and ineffective, but actually make public health issues worse. They contribute to the mistrust and distrust of the health system amongst the very communities our health and public health system most needs to reach. Leaders both elected and on the grassroots level are now calling us into action. They're calling to transform New York into the public health capital of the world. On the state level, we can make New York the public health capital of the United States by making history and passing Assembly Bill 3864. The New York State Assembly and Senate can pass this bill and send a powerful message that the health and well-being of our state, of not just marginalized patients, but all patients seeking care, rests on building an affirming, culturally competent, and patient-centered health system. New York can and must become the first state to require that health professionals be trained on sexual orientation, gender identity, and sexual health literacy by passing Assemblymember Rosenthal's bill. We will first hear from Dr. Michelle Collins-Ogle, a clinical infectious disease specialist at the Children's Hospital at Montefiore, Bronx, New York, and a member of the American Academy of HIV Medicine. Dr. Ogle.
Good morning. Thank you so much. And thank you to everyone for attending our session this morning to hear us talk about the importance of passing and supporting Assembly Bill 3864. I am a pediatric infectious disease specialist in the Bronx at Montefiore Hospital. In that capacity, I provide comprehensive gender-affirming care for pediatric, adolescent, and young adult patients. As was mentioned, it's very important that we get behind and support clinicians needing to have more education around providing care for members of the LGBTQ community, particularly kids and adolescents. Our healthcare system is designed for us to have ongoing medical education. As a clinician, every year, I have to have a certain amount of continuing medical education in order to stay current, in order to be in line with best practices within the healthcare system. This bill, Assembly Bill 3864, says that providers, whether you're a physician, a PA, a nurse practitioner, if you are a part of the healthcare system, that this needs to be and should be part of your continuing medical education. We've learned that our education, that our healthcare system is not set up to provide education on providing comprehensive transgender care. We see across the country targets on the back of trans kids where their politicians are saying that it's okay for clinicians not to provide gender affirming care. In the state of New York, we need to say that that's not okay. We need to be the first state to say that we will not put a target on the back of kids who desperately need care and need to access comprehensive gender affirming care within our community. Healthcare providers have an important role to play. The better educated we are, the better we can provide care, the more welcome kids of LGBTQ community and young adults will feel coming into our healthcare system. To end the HIV epidemic, we can't treat our way out of it. Providing HIV medication will not prevent new diagnoses of HIV in young people. And right now, young people are driving this epidemic. A lot of it is a lack of willingness to come into the healthcare system because of the way they're treated and the way they're misgendered, as was mentioned, and frankly, just the ignorance around what it takes to provide comprehensive care for our kids. To help end the epidemic, we need to make sure that we welcome all kids, all adolescents, all young adults into our healthcare system and provide comprehensive care for them. And this includes gender affirming care. This also includes care around young men who have sex with men. This also includes providing care for non-binary people who are part of they, them community. We need to educate ourselves and we need to support this bill to make sure that we provide the best care possible for all of our young people within the healthcare system. New York is progressive and bold. New York has the opportunity to continue to be progressive and bold and say that it's about time that we look at sex and sexuality and how we provide care for our young people. The opioid crisis has made it possible for us also as clinicians to be educated on this. As a clinician, I have to have at least 3 CMEs, continuing education credits each year around opioid and opioid use, substance disorder and treatment. So this is not something that's out of the ordinary. This is something that we deal with on a regular basis. 2 or 3 credits is not that big of a deal to require for us. We have to have 50 credits per year, most of us. This bill says that within 1 year that it's enacted, that we would start this continuing education credit. And then every 4 years thereafter, we would complete training and courses in providing comprehensive care around sexuality for our members of our LGBT community. That is within our scope, that is within our goal as clinicians. We should support this and get behind this to make it possible for us to do a better job at providing comprehensive care for our kids. Thank you.
Thank you so much, Dr. Ogle. Next, we will hear from Murray Penner, Executive Director of the Prevention Access Campaign, the Health Equity Initiative behind the Undetectable Equals Untransmittable campaign. Murray.
Thank you, Amir. I'm honored to join such esteemed colleagues today in strong support of New York State Assembly Bill 3864. And thank you also to Assemblymember Rosenthal for sponsoring this critical bill that would require licensed healthcare providers to complete training in sexual health, including talking to patients about sex. As we continue our push to end HIV and curb rising STI rates, it really is paramount for providers to discuss sex and sexuality with their patients. We can't expect individuals at risk of HIV and STIs to enter or even stay in care when there is still a high risk of misgendering, humiliation, or outright discrimination in provider-patient settings. There are still providers, believe it or not, who express discomfort with conversations about sex. Yet 9 of 10 patients say they would welcome their physicians asking about their sexual health. The consequences of healthcare workers avoiding conversations about sexual health are really staggering, and we could go into that, but I don't have time to do that today. Voluntary programs to increase provider competency on sexuality, sexual orientation, and gender identity have failed really to increase the competence of providers to address the needs of many affected communities, those affected by STIs and HIV. It is crucial for providers to have, at the very least, a basic understanding of identity and sexuality that are a core part of who we are as human beings. I and my organization, the Prevention Access Campaign, strongly support Assembly Bill 3864, as it would encourage culturally appropriate conversations between providers and their patients about sex, and such life-changing topics as undetectable equals untransmittable, or U equals U, which means that a person with HIV who is on effective treatment and reaches an undetectable viral load cannot transmit HIV through sex. Conversations about healthy sexual practices and how to prevent HIV and STIs are key to healthy and safe sex. And this overall is crucial to ending the HIV epidemic and curbing the high rates of STIs. I urge your support of New York State Assembly Bill 3864. Thank you.
Thank you so much, Marie. Next, we will hear from Assemblymember Linda Rosenthal, who represents New York's 67th Assembly District and who is the sponsor of Assembly Bill 3864, which would break down the barriers affecting the patients we most need to reach. Thank you so much, Assemblymember, for introducing this bill and working to combat legacies of medical mistrust that stand in the way of ending the HIV and STI epidemics.
Thank you, Amir. It is my great pleasure and honor, really, to be here among all my esteemed co-panelists. And I'm happy to be joining the HIV Law and Policy Center and all of the New York advocates for sexual probably anxiety producing for most of us. You might already have fears about a medical problem or experiencing delays in getting information about what condition you think you have after Googling it. And you may be anticipating questions your doctor might ask. But no matter what the circumstance, speaking with an unfamiliar person about your body can be uncomfortable from the start. Now, put yourself in the shoes of a person who is transgender, gender nonconforming, anyone who's other than straight and cisgender. That can be an uncomfortable and really soul-crushing experience if the healthcare professional doesn't treat you and address you the way you are. And I can imagine young people stepping into a doctor's office and being called by their dead name, their doctor just, or any other healthcare professional not recognizing them. That can not only be a threat physically, it's about nurturing, it's ensuring safety and health for people who go seek health from their healthcare. And so this bill is so necessary because many medical professionals have no idea and have never heard the words I just used and that the doctors and others just used. It's a mystery to them. And so if they don't know, they cannot possibly speak to their patients properly. And so the goal of this is to ensure that everybody in the healthcare field is fully comprehensive education on how to deal with people who are trans, binary, etc. I've heard stories of lesbian women being asked about their latest pregnancy tests, people who are transgender referred to by the wrong pronouns and by the incorrect name. And in 2021, doctors should understand that being undetectable means you cannot transmit. And so the AMA found in professionals still refused or avoided to treating HIV positive patients. And for some, it's plain ignorance and not caring to get up to speed. And for others, they just don't know. And so that is why it's crucial that it become a law that people need to be educated. And I'm a proud sponsor of the bill. And, you know, I really look hopefully with working in partnership with all of you who deeply understand the need for these continuing ed credits to be taken by everybody who's in the healthcare field so they can properly care for their patient's body and soul. Thank you.
Thank you so much, Assemblymember Rosenthal, for your work and for introducing this piece of legislation, Assembly Bill 3864, that would truly revolutionize the New York health system and ground it in a patient-centered, affirming, culturally competent approach. Next, we will hear from Kiara St. James, the co-founder and executive director of the New York Transgender Advocacy Group. Kiara?
Thank you, Amir. Hello, everyone. My name is Kiara St. James, founder and executive director of New York Transgender Advocacy Group. I often think about our progress and understanding that we are 40 years deep into HIV, right? And what we do know is that we have made tremendous strides in medications that has transitioned HIV to manageable, right, a chronic illness. But yet, when it comes to the medical field, there is much resistance in adapting to new ways of knowing. And so I want to talk about how transgender people need access to competent, affirming, sex-positive, safer sex information that is specifically geared towards my community, towards TGNC folks. And for folks who don't know what TGNC stands for, transgender, gender nonconforming, and sometimes we say gender non-binary. Barriers to care, transgender people face additional barriers to healthcare that other HIV affected people may not, especially the very real fear of being discriminated against by healthcare professionals or being denied treatment because of their gender identity. These barriers make it more likely for transgender people to avoid getting tested and less likely to remain in HIV-related medical care. Violence. In addition to the high rates of gender-related harassment and violence that transgender people face, they also have much higher rates of sexual violence than the general population and other groups within the LGBTQ community. Because of the heightened risk of being dismissed or re-victimized by police, transgender people are less likely to report their assaults or go to the hospital for post-assault care, such as post-exposure prophylaxis. And along the lines of violence, we must always acknowledge structural violence that is at play in keeping a lot of TGNC folks from not wanting to access healthcare, because you can have programs, right? You can have language that say that you're inclusive, but if we walk into your space and we don't see, we feel energy, right? And so if we don't see around us affirming information or folks who may be from our community, we're not likely to come back. And being misgender is a real form of violence that I don't think cis folks understand, that that is one of the ultimate assaults on our being. So along those lines also, just want to state that 1 out of 3 Black trans women is HIV positive, right? 1 out of 4 trans Latino women are HIV positive. So the medical field has a responsibility of becoming culturally sensitive. I don't like the word competence, right? Gender expansive, like our community is gender expansive. So as you heard me say, TGNC, NB, the medical facility, medical structures must be aware and sensitive to gender expansiveness within our community. And so we also need to make sure that we are surveying, like having surveys with TGNC folks, asking them how their experience has been, were they traumatized in that space, so that you can address that. Because one of the things you want to do is retain your TGNC community. And so if I go into a space where I'm being misgendered or I'm feeling the energy is not affirming to me, I'm not coming back, right? And that is the case for many TGNC folks. And so it's really important that we all work together to make sure that the medical field, especially medical academics, that they understand that they have an important role to play. And thank you.
Thank you so much, Kiara. I think it's precisely those feelings of alienation and the responsibility that our health system has for combating a public health problem and legacies of medical mistrust that this bill addresses. So thank you so much. Next, we will hear from David Harvey, who's the Executive Director of the National Coalition of STD Directors. David?
Thank you, Amir, and thank you, Catherine, and thank you to the Center for HIV Law for inviting me and NCSD to participate in this important event. The National Coalition of STD Directors represents state, city, and U.S. territorial governmental STD prevention and care programs. And we strongly endorse this groundbreaking legislative initiative in the state of New York. In fact, we need these types of initiatives across the entire country. So I am so honored to be with you today to strongly endorse this effort and to call for these types of legislative initiatives to be introduced in every state and local jurisdiction across the United States. As we have seen this past year during the pandemic, healthcare providers are, and the public health system is the backbone of our healthcare network. Providers hold the lives, trust, and outcomes of their patients in their hands and are pivotal in improving the health of our communities. Yet, shockingly, one national survey of US physicians found that fewer than one third of physicians routinely screened patients for sexually transmitted infections. Just this past week, we had the latest yearly report issued from CDC, which found for a 6th year in a row, sexually transmitted infection rates have been at their highest levels in American history. The pandemic has only made this situation worse. I could not be more honored and pleased to be with you all today and have the HIV community embrace a broader sexual health agenda that includes sexually transmitted infections. These are systemic issues. Our ability to end HIV very much hinges on dealing with sexually transmitted infections, which often show up first prior to someone getting HIV and presents a real opportunity for an intervention. So the reality is that people of color, young people, gay and bisexual men, and transgender people have long faced stark disparities in the STI and HIV arena. Sexual health literacy and gender-affirming health systems are critical to addressing a raging STI epidemic, gaps in care, and improving equity for all. For too long, marginalized communities have been forced to delay or forego sexual health care due to mistrust and stigma, healthcare providers' lack of testing and treatment knowledge, and discomfort, as I was just saying, with doing sexual health risk-taking assessments and offering STI screening. But this does not need to be the reality anymore. Through this legislative initiative, Assembly Bill 3864, and I thank Assemblywoman Rosenthal for leading in this effort, healthcare practitioners are provided with a better tool to change patient outcomes and offer an opportunity to engage in training that honors sexual health as a normal part of life, one that we direly need to save lives. So once again, we feel at the national level that this is a model that can be taken to other states and nationally to help enhance and provide support to clinicians. I thank you for joining with you all today and being part of this press conference.
Thank you so much, David. You know, I think it truly not only is sexual health natural, but something nearly universal to us. And the least we can ask is that the people on whom our health depend receive training on sexual health literacy. Thank you so much, David.
Well said, Amir. Thank you.
Next, we will hear from Marquise Vilson, who's a board member of GMHC, a community HIV/AIDS service organization. Marquise.
Thank you. So my name is Marquise Vilson, and I currently sit on the board of directors for GMHC. My working capacity is that of a transgender actor and also trans activist. One of the reasons why I joined GMHC's board of directors is because there's been a significant gap between healthcare professionals and transmasculine communities with regards to HIV and STI testing, prevention, education, and treatment adherence. So just a little history really quickly. A recent case study released in 2019, performed by the CDC from the years of 2009 to 2014, as case studies are run for 5 years, recorded that 58% of trans men who had been newly diagnosed were Black, 15% were Latinx, another 11% were listed as other, meaning non-white, making 84% of trans men who were newly diagnosed people of color. This case study was the first time in CDC's history that trans men were included as being part of the transgender community. I want you to listen to that. Lou Sullivan was the first publicly known trans man in the US to be diagnosed as HIV positive, and that was in 1986. That is only 5 years after the first reported case of HIV, then GRID, in our country, which was in 1981. That means upon 2019, that trans men have had to wait for 33 years to be included in the conversation around HIV, which is extremely alarming and very concerning to me as a trans man. Given the information that I've just shared, and quite honestly, for all of these reasons, I believe that it is imperative that healthcare professionals have sexual health literacy training that includes sexual orientation and gender identity. As long as healthcare professionals are not learning to understand all of the communities that are affected by HIV, their needs, their behaviors, their potential risk for exposure to HIV and STIs, there will continue to be increases of HIV and STIs among these populations. This is why I personally believe it's important to implement Assembly Bill 3864 so that healthcare professionals can reach as many people as possible to help limit and minimize the spread of HIV and other STIs. Thank you.
Marquise, thank you so much. Next, we will hear from Reginald Brown, a board member at Vocal New York, a grassroots organization working to build power among low-income people affected by HIV and AIDS. Reginald?
Good morning. As Amir said, my name is Reginald Brown. In addition, Vocal also has 3 other campaigns that we are involved with, which is ending mass incarceration, ending the war on drugs, which is actually ending a war on people who look like me, and homelessness. Almost 34 years ago, a doctor told me to get my affairs in order. The diagnosis, HIV positive. At that time, in 1986, it was pretty much a death sentence. But I didn't understand until 2014 that being HIV positive could make me be liable for arrest. So my take is going to be a little bit different from what we're talking about now. In almost 30 states, I could be arrested for being HIV positive and having sex without disclosing, even though I always disclose. I've been undetectable since 2003, and as we all know, undetectable means that you cannot transmit. But in addition to doctors not understanding what's going on and patients being reluctant, we have a say at the HIV and AIDS at HINAC, which is HIV and AIDS Learning Academy, is that take the test, risk arrest. So in addition to all of this other things, all the stigma of that, people also have to deal with the fact that there's a stigma about being arrested. So in addition to doctors being incompetent, patients also have to, potential patients also have to deal with the fear of arrest. I'm privileged. My mother was a nurse practitioner. So being in healthcare has been something that's been normal for me. So when I go to the doctor, we have a conversation. And if I cannot have a conversation with them as I'm having with you, I say, hey, wait, what's going on? I am not anyway passive, but again, I realize my privilege is that I will challenge them and I will push back. And if I'm not getting where I want to get, I will leave. I will go someplace else. So in addition to this, the doctors do need to be aware that the people who are coming in there are not only dealing with the stigma of HIV, but also the stigma of possibly being arrested, not understanding that the doctor will not say anything to law enforcement. But if you have all of these things going on, that's just another level of what is happening. Assemblymember Rosenthal, it's always good to see you. You are a trusted ally and good friend of Vocal. Keep up the good work. I'm proud of you. Thank you.
Thank you so much, Reginald. I think it's exactly that fear of the collateral legal consequences to an HIV diagnosis, not only the fear of criminalization, but the fear of how an HIV diagnosis could affect your immigration or asylum status. We need health professionals to be trained in sexual health literacy, sexual orientation, and gender identity to reach the patients that are affected by that mistrust, distrust, and fear, to reach out to patients, to bring them in and retain them in care. So thank you so much, Reginald. Next, we will hear from Kimberleigh Smith, the Senior Director for Community Health Planning and Policy at the Callen-Lorde Community Health Center. Kimberleigh?
Hi, good morning. I want to thank the Center for HIV Law and Policy for bringing us together this morning, and I want to thank Assemblymember Rosenthal for sponsoring this very important bill. My name is Kimberleigh Smith. I'm with Callen-Lorde Community Health Center, a community health center that was founded to provide comprehensive, affirming, and high-quality health care to lesbian, gay, bisexual, and transgender communities, as well as people living with HIV in New York City and beyond, free of judgment and regardless of ability to pay. We came to be more than 50 years ago, not just to fill a void, but to actively combat medical mistrust and medical violence perpetrated on our communities. A group of countercultural volunteer clinicians sought to provide supportive, primary sexual and mental health care for the hippies, freaks, and queers in the East Village at the time. We soon mobilized a clinical and activist response to the HIV and AIDS epidemics, and it turns out that the care we provide today for our 18,000 LGBTQ, including Black, Indigenous, and people of color communities, is the care everyone deserves. So I would not be the first to say that Callen-Lorde is a special place, but we should really not be that special. In 2021, as others have mentioned, it is still well documented that LGBTQ individuals face challenges and barriers accessing needed medical services. As a result, they can experience worse health outcomes. In fact, 15% of LGBTQ Americans reported postponing or avoiding needing medical care when they were sick or injured due to disrespect or discrimination. And this number actually jumps to 28% for TGMB respondents. So sexual health is a topic about which the larger healthcare system and mainstream healthcare providers tend to remain woefully uninformed. And this includes issues relevant to HIV, like U equals U, and STIs, as well as the overall competence in serving our LGBTQ community members. And at Callen-Lorde, we know this because we see thousands of patients each year who are perfectly happy with their primary healthcare providers, but seek out our sexual health services only. They come to us just so they can speak openly about sex with our providers. Without judgment, they come to receive compassionate and high quality healthcare. So we work hard to treat our patients, but we also share our model and our best practices with healthcare institutions and other providers across the country and actually really the world. Medical students are even eager for this information, but it is not enough. And as we heard before, voluntary programs over the years have yet to have a real impact. Our mainstream healthcare systems are the ones that are lagging behind, and the ultimate is ongoing harm to our communities. And we even see this today with the COVID-19 pandemic and the rollout of the vaccines. So the time has come. The time is now to require that all healthcare staff in New York understand the importance of possessing and promoting sexual health literacy. The time is now to ensure that all of our state's providers are equipped to treat our whole selves. So we urge the passage of Assembly Bill A3864. Thank you.
Thank you so much, Kimberleigh. You and I are not the first to say that Callen-Lorde is a special place, and New Yorkers should not have to commute statewide across the state to a Callen-Lorde clinic to receive affirming and inclusive care. It's irresponsible, and now's the time to pass Assembly Bill 3864 to make sure that all medical professionals have the tools that they need to reach their patients, to speak to their patients with respect and dignity, and provide dignity-centered, patient-centered care. Thank you so much, Kimberleigh. Next, we will hear from Kathleen Bernock, a family nurse practitioner and specialist in both HIV and viral hepatitis treatment and prevention, and the president of the New York chapter of the Association of Nurses in AIDS Care. Kathleen.
Hello, everyone. I just want to thank everybody for being here. Expanding sexual health education for providers is incredibly close to my heart. It's a lot of the work that we do with the Association of Nurses in AIDS Care is really trying to provide continuing education to persons working in the health field to have a better understanding of, how to provide sex positive care for patients. A, for their health, overall health in general, and B, also to make sure that they feel comfortable coming into the clinic to speak to people. So I, as a nurse practitioner, I've been in a fairly unique position because I'm not only an HIV specialist, I also provide full scope primary care within federally qualified health centers in hard hit communities. And so I understand the stress that primary care providers feel on a day-to-day basis. It's not an easy position to work in. There's a lot of demands. There's a lot of different quality indicators we have to meet. We were talking about diabetes, high blood pressure, asthma, I mean, so many things on the plates of all of these providers that if sexual health is not being prioritized, then it's not going to be done. And so if we're prioritizing quality indicators just for asthma and high blood pressure, and we have to meet all these marks and check all these boxes, but no one's prioritizing sexual health, then it's not going to get on the list. And, as much as I want to say that it's a clinician's responsibility to know and do this, sometimes it is something that really just needs to be mandated. So at one of the clinics I worked at, I was able to get leadership involved in expanding HIV testing, Hep C testing for the clinicians, and talking about 3-point testing and doing targeted education with 3-point testing for patients. So, most providers never learn that gonorrhea and chlamydia only goes where it touches. So if you have a patient who has never had receptive vaginal sex or who has never, been on top during penetrative sex, that patient's urine is always going to show up negative, and they may go through life thinking they've never had an STI because no one's tested them appropriately in the right places by doing anal, rectal, or oral swabs. And that providers don't learn this. So it's something, there's a lot that we do not learn about sexual health. And I feel like it's our responsibility to our patients to know these things, our responsibility to ending the HIV epidemic, to know these things. Having positive anal rectal STIs is a really huge indicator of HIV risk. And if no one's testing or doing anal rectal swabs, or even knows that they're supposed to be doing this, or doesn't feel comfortable talking to people about their anal rectal health and what type of sex they're engaging in, then we're not going to be able to end the epidemic, because by the time somebody gets to an infectious disease provider or a specialist, a lot of times, unfortunately, it's too late. And I've had a lot of conversations with people newly diagnosed with HIV, unfortunately, coming to me for the first time for care. And, I had a young MSM patient who had been told 1 month prior that he was not eligible for PrEP. And he was negative at that time. And within a month, he had been diagnosed with HIV and came into the clinic to see me. And, another time, trans female patient coming in to the clinic newly diagnosed with HIV who said, how come nobody ever told me about this before? I would have loved to have been on this preventive medication and just never heard about it. And all I can say is, I'm so sorry, but providers aren't educated, and I wish somebody had told you. I wish that you knew, and I wish that you had access to the care that you deserve. And so, I really want to thank Assemblymember Rosenthal, because I think it really is so important for providers to be mandated to do this. We are so busy, and if we're not mandated to do something, we're not going to do it. So thank you so much. I really hope this goes through. I think it's so important for New York.
Thank you so much, Kathleen. I think it seems like the New York State AIDS Institute, the New York State Department of Health AIDS Institute, is aware that there are certain people who are responsible for late HIV diagnoses or concurrent HIV/AIDS diagnoses, people who haven't been connected to the care that they need, partially because, as you said, providers aren't trained, they're uncomfortable perhaps talking about sexual health history with patients, or they make outright assumptions about patients' sexual activity and may not offer HIV testing to patients. So thank you so much, Kathleen. And finally, we will hear from Bryson Rose, Director of Advocacy and Capacity Building at Hetrick-Martin Institute, an organization that serves LGBTQ youth. Bryson?
Thank you for having me, Amir, and thank you to Assemblymember Rosenthal for pushing this forward. My name is Bryson Rose. I'm the Senior Director of Advocacy and Capacity Building at the Hetrick-Martin Institute, and I'm so happy to be amongst family and new family and old family on an important issue. I am known to be very long-winded, so I wrote something, so I'm going to read it because you don't want to be here all day. So here it goes. Hetrick-Martin Institute, the nation's oldest and largest nonprofit serving LGBTQIA+ youth and their families, offers our unwavering support of Assembly Bill A3864. By ensuring that medical professionals are building their capacities around the ever-evolving landscapes of gender identity and sexual orientation, our state, New York State, can ensure that LGBTQIA+ youth will get the necessary care they deserve in ways that are affirming of their humanity, honor their dignity, meet their needs, and ameliorate health disparities they face. LGBTQIA+ youth often do not have safer spaces to talk about their bodies in ways that are empowering, or discuss the romantic and sexual relationships they have or want to have because of shame and stigma. This is especially harmful in the context of offering medical care, where unasked questions and non-existent conversations can lead to health complications for an already marginalized community. Through the passage of Assembly Bill A3864, it is our hope that providers will become more aware of the language, tools, and strategies they can employ to embolden youth to take ownership of their sexual and reproductive health. Medical providers are often seen as trusted and knowledgeable adults with a considerable amount of influence. Hetrick-Martin Institute believes that through the Assembly Bill 3864, we will be able to equip medical providers with the relevant information, tools, and skills to foster respectful and meaningful dialogues with their LGBTQIA+ youth patients, and thus improve health outcomes for this population. We urge members of the New York State Legislature to support your colleague, Assemblymember Linda Rosenthal, and LGBTQIA+ youth by passing Assembly Bill A3864. Peace and power to you all.
Thank you so much, Bryson. I really want to take a moment to just thank all of you and Assemblymember Linda Rosenthal for rallying behind this issue. And I think as Kathleen noted, if this kind of critical, revolutionizing training isn't mandated, providers will not seek it out and take it upon themselves to educate themselves on sexual health literacy, sexual orientation, and gender identity. There's a question in the chat about how the New York State Department of Health AIDS Institute does provide free continuing education training on a variety of issues, and we think that's an important part of this. We'd like to see that initiative. I think my concern, and I think I share this concern with everyone that I'm joined here today, is that years of an investment in voluntary training programs haven't moved the needle. HIV and STIs remain at epidemic levels, and as we heard David Harvey from the National Coalition of STD Directors say, we're actually at a moment of crisis, particularly as we're bending the curve combating the COVID-19 pandemic. There is a unique crisis here. I think the only answer is to universalize mandatory continuing education requirements on sexual health literacy, gender identity, and sexual orientation. And for New York to chart a bold path forward to make history and become the first state to require that this kind of continuing education is tied to medical licensing and certification. So thank you all for joining us today. Terry, I can follow up with you on your question after this. But thank you, Assemblymember Linda Rosenthal, for introducing this proposal to combat legacies of medical mistrust and to really ameliorate those barriers, to break down those barriers between patients that we most need to reach and the care that they're seeking. So thank you, everybody. Thank you for coming.